Hi, my name is Abby.
And I'm Janelle.
Have you ever thought about how you plan to be a patient? The Take Charge campaign will help people to be better prepared patients. Think about getting into an airplane. The flight attendant tells you about the emergency exits. Or if you get into a car, you buckle up because of what might happen, not because you're a bad driver, but someone can make a mistake. People are taught CPR before witnessing a heart attack. So, why aren't people taught to be patients, especially when medical errors are the third leading cause of death in the United States?
The Take Charge campaign focuses on 5 steps to safer healthcare. This is a 6-month campaign starting in March 2020, and each month we will focus on another step until everyone has the 5 steps completed or planned. Whether you work in healthcare or think you know the best, chances are you probably need some help completing these steps. Don't wait to get this information in the hospital or medical clinic. By then, it might be too late. These are the 5 steps.
Number one, understand and complete your advance directives. Who will speak for you if you fall unconscious and can't speak for yourself? Sure, your family can be told what is happening, but what if you may not be able to speak for yourself? You want to be sure someone knows your wishes, such as pain treatment, experimental treatment, and even life support. The person you choose as a health surrogate or healthcare proxy needs to know your wishes, so have this conversation with someone that you trust.
Number two, keep a record of your medical history and current medications. Did you have your appendix out or a broken leg when you were 13? Make sure this is part of your medical history and you have this information ready to be shared. No medications, because a new symptom may actually be a side effect from another medication. You might need a prescription change from a generic to a name brand, but they do the same thing. You need to know all of your medications and why you take them. Include in this list any over the counter medications, vitamins, and herbs. It couldn't hurt to list your diet too if you're vegan or avoid certain foods because you have allergies.
Number three, prepare for doctor visits and make a list of questions. Prioritize what you want to talk about. A new medication? Do you need your flu shot? Are you feeling depressed or anxious? Have you had a sudden weight gain or loss? Prepare these questions before you get to your medical appointment.
Number four, prevent infections and ask caregivers to wash their hands. That is hard to do, but 1 in 25 people who are hospitalized will get an infection from their hospitalization. Think of hand washing as trust and respect. If you respect me, you will wash. I can trust if you do what you're supposed to do. People who are caregivers, especially professionals, know they are supposed to wash their hands, but they may forget. You may also use this opportunity to ask a clinician to tell you what they're doing and when they're going to touch you. You have a right to know what is happening to you and why.
And last but not least, number five, use an advocate, be an advocate for others. This can be a professional or have a friend or family member ready to help you as your support person or advocate. They can help you navigate the healthcare system if you feel scared or vulnerable. They can help ask questions, write down answers, and whatever it is you need them to do. Think now who you might want that person to be as your helper, and plan to do the same for them if they are suddenly sick or injured.
To learn more about the Take Charge campaign and 5 steps to safer healthcare, visit www.takecharge.care. Did I say that right? www.
Yeah.
Okay. Um,